My family and I, we'd like to thank you all very much. So many of you have worked so hard to bring this opportunity forward. It's an honor that we could be with you to share our father's story. We want to thank you, Congressman Johnson and Senator Feingold and Senator Cole, for all the work that you folks have done. And I want to thank another person. A lady named Anastasia taught me yesterday how precious and how important our liberties and civil justice are to us, that we as Americans can take for granted. And today this is showing we're not doing that. Again, my name is David William Kurth. My father was William F. Kurth. He loved our country and served many years as an officer in the United States Army and the Wisconsin National Guard. My father was an Eagle Scout and a Boy Scout leader. He served as a volunteer fireman for our community for over 25 years. He taught his children and many others to love and serve this country. He taught us to obey its laws, respect its traditions, and uphold its rights. He was an honest man. He was a mentor to many people. He was a good man, and he was my hero. My father entered Mount Carmel Nursing Home in Burlington, Wisconsin in October of 2004. In February 2005, while left unattended, Dad fell. He complained about the pain in his hip throughout the day. It took another 12 hours before they found out that he had actually broken his left hip. He spent the next several days in Burlington Memorial Hospital having his hip repaired. Shortly after returning back to Mount Carmel Nursing Home, his left leg was broken again during physical therapy that was improperly applied. My mother said that during this session, the therapist insisted that my father's leg be fully straightened. My father was screaming in pain and trying his best to resist their efforts. Yet they persisted, didn't listen, and broke his leg again. It was about this same time he contracted the MRSA infection. During this same time, his health care coverage changed from Medicare to Medicaid. The very day his coverage changed, he was moved from his private room in the Medicare wing of the facility to a shared room in the Medicaid wing of the nursing facility. The staff had not cleaned his room prior to his arrival. Dad's new room was filthy and smelled of feces. The bed he was placed in was coated with dirt. My wife and I had to personally clean his room and his bed the following Sunday after he was transferred to this Medicaid wing. His room was never properly cleaned throughout his stay. The bathroom he shared with 3 other men had not been cleaned in a long time. We didn't know then, but the management team of the nursing home had made a cost-cutting move and disbanded a multi-member wound care team. What this meant that for a facility of 150 aged and infirm patients that had been cared for by a committee of 5 people overseeing their wounds, they were now to be attended by only one person. The court records and testimony show that the sole wound care nurse never attended my father's wounds for weeks and even months. Even after it was brought to our attention by the visiting doctor in late April, none of us had any idea that he was in such poor condition. During this time, the only staff member that discussed my father's situation with us was the nurse that had administered my father's medications. The doctor, upon seeing the progression of my father's illness, had my father rushed by ambulance to the emergency room at the Burlington Hospital. My father was admitted to the hospital that very morning. The doctor told us of how shocked he was at the poor care my father had received at the nursing facility. His words were that of neglect and disappointment that a nursing staff could let someone to deteriorate to such a condition. At this time, the doctor told us that my father was terminally ill and that my father did not have much chance of surviving these infections. My father was admitted to the hospice section of the hospital. A few days later, he was transferred to a hospice in Wauwatosa, Wisconsin. Here he was finally provided the very fine care for his last few days with us. My father died on June 25, 2005, from sepsis of the blood due to infections caused by more than 10 bed sores. Some of these bed sores ran deep into the bones of his backside, hips, and pelvis. The infection was caused by the excrement and urine that was not properly cleansed from his wounds for days at a time. The bed sores were caused by neglect. The wound care nurse that was responsible for caring for my father has been charged and found guilty of criminal neglect by the state of Wisconsin for these actions. As revolting as all of these ordeals for my father and my mother may sound, this is not the most shocking part of my father's story. My father's ordeal was hidden from the light of day by a document called an arbitration agreement, which he himself never signed. My mother was instructed to sign them by the admission clerk at the nursing home while no one else was present. Ladies and gentlemen, my father's story is not an isolated case. Nursing home corporations are using arbitration clauses as liability shields to insulate them from their own wrongful conduct. In my father's case, it was economically more profitable to let people like my father suffer than to provide the proper care. And if by chance the surviving family member is moved enough to hold the corporation to account, the whole ordeal gets buried in secret arbitration agreement and committees, which is also hired by the nursing home. The public is none the wiser. All the while, the surrounding community keeps sending their elderly to these places, totally unaware of their continued abuse because the corporation has it all locked up and away, nice and tidy. Ladies and gentlemen, my sister and I plead with you to help right a great wrong that is being perpetrated on the elderly and infirm of America. If you, in your wisdom, can see fit to ban the use and practice of these arbitration agreements upon the elderly entering nursing homes, you will be correcting the management of their care. Without these arbitration agreements to hide behind, all nursing homes in America will have to improve the care they provide to the level that is necessary and expected of them. This country was built upon the infirm that now reside in these nursing homes. The veterans that fought for us, teachers that taught us, provided us knowledge, the carpenters that built our homes and businesses, the little old ladies that taught us Sunday school. They all live in these nursing homes. They took care of us. These are our heroes. Now it's time we took care of them in a manner which is worthy of the sacrifices they've made for us.